Can fruits and vegetables prevent type 2 diabetes? How about whole grains? Can they prevent type 2 diabetes? I'm Dr. Brett Scher, the medical director at DietDoctor.com. And this is important because two new studies in BMJ came out suggesting that conclusion, that the more fruits and vegetables you eat, the less likely you are to get diabetes. So it can prevent type 2 diabetes, and the same for whole grains. But that's not necessarily true. And we've talked about this before, these poor quality nutritional epidemiological studies that the conclusions are far greater reaching than the actual strength of the studies. And every time one comes out, I'm going to have to keep making these videos and keep writing articles about it because people need to hear this, because it's dangerous. It is dangerous to interpret these studies incorrectly. So here's the studies. The first was a look at the usual, looked at, I think it was 3 or 4 different nutritional epidemiological studies where they gather as much information as they can for people with a food frequency questionnaire every 4 years, right? What'd you eat 4 years ago? What'd you eat 3 years ago? What'd you eat 2 years ago? How many grains did you eat? We know this is an unreliable way to get data. So right away, we're starting with poor data. And then they crunch the numbers and say, okay, who gets type 2 diabetes and who doesn't? You go through and you look at everything to see what correlates. And it turns out the more whole grains you ate, the less likely you were to get type 2 diabetes. But that does not mean whole grains prevent type 2 diabetes. By no stretch of the imagination does that mean that they prevent type 2 diabetes. And that's the danger. Because if you read this study and you say, I want to prevent type 2 diabetes, or I want to treat my type 2 diabetes based on these conclusions, I better eat more grains. No, that's not how it works. All this tells you, because then when you look at the data further, the people who ate more whole grains also exercised more, and they smoked less, and they drank less alcohol, and they were healthier because they're following the advice that they're given by the American Heart Association, by the American Diabetes Association, by their physician to eat more whole grains. They're going to be more likely to be proactive about their health and be concerned about their health. So the healthy user bias is rampant in this study, and that's really all it concludes. We can't conclude that whole grains make you more likely to quit smoking, but that's using the data, you can make that same conclusion, but you don't see those headlines. So I think this is a dangerous misinterpretation. Now, whole grains can be part of a healthy diet, right? Look at the blue zones. They have plenty of whole grains. Look at, so in certain populations, whole grains certainly can be part of a healthy diet, but that is different than saying whole grains are the way out of a metabolic disease. So if you already have type 2 diabetes, if you're overweight and insulin resistant, whole grains isn't your way out. And a misinterpretation of the study could make it seem like it is. And we have a whole guide on whole grains that goes through this in detail. So we'll post that down below. Then the other study that looked at fruits and vegetables, at least it was better in the sense that they didn't rely on food frequency questionnaires. Instead, they did blood tests for vitamin C and carotenoids and things that would reflect vegetable and fruit intake. So that should be more accurate in terms of what people actually ate. But other than that, it's the same story. The people who ate more fruits and vegetables were healthier at baseline. No secret there. I mean, that's been shown in probably hundreds of different trials, many of which I've made videos about and made rants about, like I'm doing here. But all this tells you is the more fruits and vegetables you eat, the healthier you are. It does not mean if you eat more fruits and vegetables, you will prevent type 2 diabetes, right? Now, there's an old saying, look, vegetables didn't get us into this mess. We shouldn't pretend that vegetables and fruits are the problem. But we also shouldn't pretend that fruit is the solution. No, because if you are already overweight, if you are already insulin resistant, if you already have type 2 diabetes, you can certainly eat some amounts of fruit. Fruit is a dessert. Fruit is a sweet. Fruit is a treat. But to think you have to eat more and more and more and more and more fruit because there's something inherent to fruit that's going to help treat or prevent your type 2 diabetes, that's a completely wrong conclusion. And I'm afraid that's the conclusion many people get by the press covering this type of study. So hopefully this is helpful, and I'm just going to keep screaming from the rooftops about this. And also down below, we'll link to our guides on fruits and vegetables so you can learn what are the best choices from a low-carb standpoint if you want to enjoy your fruit but still have minimal impact on your blood sugar and your insulin. So just please be wary about any of these nutritional epidemiological studies. We have to be very careful how we interpret the results. There's nothing magical about whole grains and fruit that are going to help you prevent your type 2 diabetes. Thanks a lot. Hopefully this was helpful. If it was, click the thumbs up down below and also click subscribe so you get all our updates and our podcasts and our other YouTube content. All right. Thanks a lot, everybody. Have a great day.